Welcome to Module 1 of First Do No Harm. What every educator needs to know about children experiencing chronic illness, post-viral illnesses, and long COVID. My name is Dr. Angela Grace. I'm a registered psychologist in Western Canada, and I work with children and families with long COVID. Part of the team is also Kara Cow, a pediatric physical therapist from Edmonton, and Jennifer Thompson, a parent advocate. Throughout these modules, we're going to talk about the basic facts about chronic illness, post-viral illnesses, and long COVID. You're going to hear a family story of long COVID. We're going to discuss what parents and students need teachers to know. You'll also hear information about what you may observe in the classroom. We'll discuss school-based accommodations that you can easily implement to support these children. And we'll also talk about prevention strategies. I'm going to be talking about the basic facts, chronic illness, post-viral illnesses, and long COVID. We're going to begin with an analogy about the peanut allergy rule of thumb. So if you think about peanut allergies, what is our scope of practice as educators? We are not doctors, we are not nurses, we are not public health experts, but there are some things we need to know. We do not need to know how to diagnose, and we do not need to know everything about peanut allergies. What we do need to know are the basic facts that peanut allergies exist, and they can be very harmful to children. We need to know who is at risk because it's an invisible allergy. We need to know what to do if you observe or a child demonstrates symptoms. We need to know how to prevent an allergic reaction, and that's by not allowing the allergen to get into the body. And we also need to remember that parents and the child are the best sources of information for the child. If we extend this idea to post-viral illnesses, to long COVID, to any other chronic illness, our scope of practice is the same. We do not need to know how to diagnose, and we do not need to know everything about the illness. But we do need to know the basic facts that post-viral illnesses exist, that they are very serious, and they can significantly impact a child's life. We need to know who is at risk because these are invisible illnesses. And the basic fact is every child is at risk. We need to know what to do when we observe or a child demonstrates symptoms. We need to know how to best prevent airborne illnesses. And just like peanut allergies, it is by not allowing the pathogen to get into the body. We prevent airborne respiratory viruses. And we also need to remember that parents and the child are the best sources of information for the child. So these are some other basic facts about chronic illness, post-viral illnesses, and long COVID. Children with these illnesses do not bounce back or snap out of it. They are also not psychological or because the child is lazy. These children are ill, and they are impacted in every area of their life, including functional and cognitive limitations. There is a high risk of complexity and susceptibility to contracting other illnesses. Parents are deeply concerned about their child's well-being when in the care of others. When parents bring their children to school, we have so much responsibility for their care and well-being. And parents and children need to be heard and taken seriously. If a child says, "I don't feel good," we need to believe them. If a parent says, "Something's up with my child and they're not well," we need to believe them. When we talk about chronic illness in the classroom, we often think of conditions that students are born with. But we need to understand the basic fact that for many children, a common infection can be the start of a long-term, life-altering condition. We aren't just talking about a slow recovery from a cold. These are often new and lingering symptoms after the acute phase of a viral or bacterial infection, and these symptoms can last for weeks, months, or even years. Research shows that common infections like Epstein-Barr, influenza, COVID-19, or strep can increase a student's risk of developing a post-viral and chronic illness. An Epstein-Barr infection can increase the risk of developing mono, or ME/CFS. While most recover from mono after a few weeks, symptoms can last up to 6 months. And for some, Epstein-Barr triggers myalgic encephalomyelitis, causing severe fatigue that doesn't improve with rest, which prevents a student from doing their usual activities. Influenza can increase the risk of Parkinson's disease years down the line. We are learning more every day about how common infections can have long-term consequences for brain health, increasing the risk of developing Parkinson's decades later. A COVID-19 infection can lead to long COVID. We now know that some children do not fully recover after their initial infection with COVID. Instead, the virus can cause a multi-system illness that can affect everything from their heart rate to their ability to think clearly. A variety of infections can cause inflammation in the brain, triggering PANDAS, Pediatric Acute Onset Neuropsychiatric Syndrome, a sudden, dramatic change in a student's behavior and emotions, literally overnight. We also know that strep A, like strep throat, can cause a condition called PANDAS, Pediatric Autoimmune Neuropsychiatric Disorder associated with strep infections. Viral and bacterial infections can also sometimes trigger POTS or dysautonomia. Some students find that after an illness, their autonomic nervous system no longer regulates basic functions correctly. This can cause symptoms like a racing heart, dizziness, and fainting simply from the stress of sitting or standing at a desk. Every child is at risk. As educators, our role isn't to diagnose, but to recognize and understand that if a student's health or behavior shifts following an illness, it may not be all in their head. It could be a complex physiological post-viral condition that requires medical attention first, and it requires us to adjust our approach and provide the right support during their recovery. So how common are these post-viral, chronic, and often invisible illnesses in children? So let's look at the prevalence of myalgic encephalomyelitis or chronic fatigue syndrome. Approximately 83 to 373 in 100,000 children will have ME/CFS. That means in a school of about 500 students, at least one child will have ME/CFS. For mast cell activation syndrome, the prevalence is 1 to 17%. So this means about 1 to 9 children in a school of 500 will have MCAS. For PANS and PANDAS, the prevalence is 1 in 200. So 2 to 3 children in a school of 500 will develop PANS or PANDAS. Dysautonomia is a dysfunction of the autonomic nervous system, and there's more than 70 million people of any age worldwide. That means it's actually quite common in our schools. The basic facts about COVID-19 in children. Well, we all know that SARS-CoV-2 is an airborne virus that causes COVID-19 and subsequently long COVID. COVID-19 is not just a cold. It literally is a virus that causes a multi-system vascular disease. And every reinfection increases the risk of adverse outcomes. One acute infection can contribute to long COVID. A second increases the risk. A third increases the risk. How many people do you know that have had this more than once and have never bounced back? So the basic facts about COVID-19, it's not just a cold, it is a multi-system vascular disease. Every organ system can be impacted. It can cause inflammation in the lining of the blood vessels. It can cross the blood-brain barrier and impact the brain. It can damage the immune system, and it can cause long COVID. Every reinfection increases the risk of adverse outcomes. It can worsen already existing health conditions. If a child has asthma, diabetes, mental health issues, these can be exacerbated. It can also cause new long-term health conditions. It can cause cardiovascular disease such as myocarditis, arrhythmias, blood clots, and heart attack. It can cause neurological disorders, cognition, memory, migraines, sensory, mental health, and stroke. It can cause autoimmune conditions like type 1 diabetes and multi-system inflammatory syndrome. Other basic facts that we need to know about long COVID. There are over 200 symptoms. It is truly an invisible illness. These symptoms may fluctuate and relapse over time. And at this point in 2025, there is no known treatment for pediatric or adult long COVID. There is only symptom management. I'd also like to point out some of the most common symptoms in children that are shown on the infographic. Neurological impacts like mood, fatigue, sleep, headaches, and cognition are among the top symptoms. There's cardiorespiratory impacts like orthostatic intolerance, exercise intolerance, and chest pain. And then there's other common symptoms like loss of appetite and altered smell and taste. Long COVID is akin to the damage after a hurricane. It requires gradual recovery and rehabilitation. It is important to set realistic expectations for student progress because recovery is long and nonlinear. There are long-term effects of COVID-19 on the brain. Once that virus crosses the blood-brain barrier, it can impact so many brain structures. It can cause long-lasting neurological symptoms. These symptoms are compared to traumatic brain injury or a concussion. Some symptoms may be mild, some may be moderate, some may be severe. Symptoms can include dizziness, balance issues, loss of taste and smell. One of the most common symptoms in children is headaches. And of course, any neurological symptoms can impact cognitive functioning and physical abilities in the classroom. So how common is long COVID? A study published in Nature Medicine in August 2024 said that 400 million people worldwide have long COVID, and only 7 to 10% of long COVID patients fully recovered after 2 years. That means that 90 to 93% of people with long COVID have not recovered after 2 years. There are millions of adults out of work due to long COVID, and the economic cost is $1 trillion each year and rising. In the June 2023 Stats Canada survey, so this is 2 years ago, 3.5 million adults have experienced long COVID symptoms. 2.1 million are still experiencing long-term symptoms. There are increased number of missed days from work and from school, and far too many people have reported no improvements in their symptoms over time. We are creating a society full of disabilities because we are not preventing and mitigating long COVID. So let's think about educators in Canada with long-term symptoms of COVID-19. There's an 11% risk of long-term symptoms after one infection. There's a 38% risk of long-term symptoms after 3 infections. Over 30,000 Canadian educators could continue to have long-term symptoms. So think about it. We already have teacher shortages across Canada. Can we really afford to have more than 30,000 teachers in Canada on reduced work hours, short-term disability, or long-term disability? How does this impact student learning? How does this impact quality of life for those sick individuals? And how does this impact our society if people are becoming and staying ill? This is a BC study that was published in July 2025. It speaks about the chronic health consequences of the COVID-19 pandemic on school workers, as well as the rates of chronic illness and daily limitations for school workers. In July 2025, 31.1% of school workers reported new onset chronic symptoms, and 10% reported significant daily limitations. This means our school workers are having a very difficult time doing their jobs. The study conclusion is that in a highly vaccinated sample of school staff, many individuals reported post-COVID-19 related chronic health symptoms. These findings have important public health implications, mandating further research in this area. There is a need to develop health programs to address this significant disease burden and mitigate the long-term effects of the pandemic on school staff. So now let's turn to how common is pediatric long COVID. This is Dr. Rao's presentation to patients and healthcare professionals from the Second Canadian Symposium on Long COVID in October 2024.
So what about the frequency of long COVID? So how often or how common is it in kids? So it turns out this is an extraordinarily difficult question to answer. And some of that comes back to what I talked about before, about how there are a lot of different definitions for long COVID. And so depending on the definition that you use, depending on the population that you're looking at, depending on the setting, you can get really vast differences. So some of these studies look at just kids in long COVID clinics, where you're going to get very different information from if you're maybe looking at the general community. So this was a systematic review that was published that was reporting the prevalence of long COVID in children. And so the graph is showing you the percent of sort of symptoms that were prevalent in different research studies. And the numbers range all the way from sort of 1.5% all the way through up to 70% prevalence. So if you focus though on the ones that are more community-based, that have a comparison group, that are more prospective, that are sort of the better conducted studies, people estimate that there is at least one persistent symptom occurring a month or more after having SARS-CoV-2 in kids about 10% of the time, so based on some of these US studies. And so again, just kind of to highlight, this is not a rare disease. This is something that we are seeing with significant frequency in kids as well as adults.
It is very clear from Dr. Rao's presentation that long COVID is not a rare disease. How common is pediatric long COVID? A recent article published in JAMA Pediatrics in May 2025 says that long COVID is common, affecting up to 10 to 20% of children with a history of COVID-19. Almost 6 million US children are potentially affected. This is higher than children with asthma, the most common chronic health disorder in children. How many children in Canada have long COVID? We don't know because our government is not tracking it. Part of the reason it's not being tracked is because most of the research has been focused on adults, leading to the misperception that long COVID in children is rare. Pediatric long COVID is not rare. So we know that children are suffering in silence. We know that doctors are missing symptoms and are misdiagnosing children, sometimes saying that the children or their parents have mental health issues and are fabricating symptoms. This is not true. We need to believe the kids and their parents. It's hard for these children to be believed. Therefore, it's hard to get a medical diagnosis the support and accommodations that they actually need, let alone treatment. It's hard to get educational support, so we as teachers and educators and administrators, we need to know how to best support these students. The estimated pediatric long COVID numbers in Canada, 70 to 80% of BC children were infected by August 2022, compared to only 60 to 70% of BC adults. Based on Canadian demographics at September 24 and a 10% prevalence, there could be over 500,000, that's 500,000 Canadian children living with long COVID who have little to no support in schools. So if 1 in 10 infections equals a child having long COVID, it truly is the elephant in the room that we have to talk about and have to take seriously. We need to believe children when they say they don't feel well. We need to believe parents when they say my child has not bounced back and we need your help. These children may be ill for a very long time and they deserve and need our support. I'm now going to turn you over to Module 2, which is Jennifer talking about her family's experience with long COVID.